Good evening. I'm Dr. Mike Fiorito. I'm part of the ACE committee, which plans the annual meeting, and we're excited to have Dr. Kusek here with us. We wanted to just talk a little bit more about his lecture that he's going to be giving on Saturday, October 3rd at the meeting. Dr. Kusek, can you give us an idea of what your topic is and what we can expect from the meeting?
Yeah, I thought I'd put out a different type of topic that's not normally seen at the annual meeting. So my workshop says it, can you be a homeopathic dentist and an implant dentist? Use of adjuncts to increase healing and success and decrease postoperative pain. So it's kind of weird when I started doing some different things in my office, and I've had people that start contacting me for because they think I'm a homeopathic dentist.
Right.
Just because I do some saliva testing and using probiotics, and so they contact me and want to know there's alternative ways to doing some things. Well, that was a good catchphrase for a lot of things, but yeah, I think as far as implant dentistry, one of the things I'm going to concentrate on, and people who sign up for it, we're actually going to do some saliva tests at the workshop, and you could actually then you'll get the results from yourselves to see what type of bacteria you have, because we're seeing that there's maybe six of the red bacteria that are actually very aggressive that could cause, yeah, definitely bone loss and perio issues, periimplantitis, but then there's systemic issues that they could cause cancer and stroke, cardiac issues, issues with pregnancy, dementia, all those things, and when I see patients that have a lot of inflammation in their mouths and we bring that forth to them, and then I tell them there's a systemic problem with that, they're willing to take the saliva testing for it. And then one of the easiest things that we do, and we've found some really great results, is putting them on an oral probiotic. Well, there's only one oral probiotic that has been actually tested that shows that it releases the good bacteria in the mouth and can diminish the bad bacteria. So with implant dentistry, I mean, we need to, diminish the bacteria that's creating in there, which could cause implant failure or periimplantitis down the road. So those are things we're doing just all the time when we have a patient come in for an implant consult.
Can you give us an example maybe of how they would use probiotics around an implant?
Well, it's very simple. First, they're going to do the saliva test, and then we'll get the results back and see what type of bacteria they have. May have AA, PG, TD, FN, and all those weird names that you memorized back in dental school. Uh, So when we find that out, then the first thing we'll do is put them on an oral probiotic, which uh, after they've eaten their last meal, at least by a half hour, and did their brushing and flossing, they just let this little tablet melt in their mouth. And it takes about 2 to 3 minutes, and that releases the good bacteria in their mouths. Cases that we've seen, for implants and basically for our normal patients that they're taking these probiotics. We've taken patients that, they feel inflammation, they're bleeding all the time. We may have tried laser treatments on them, but this stuff is really working well. It decreases their pocket depths. We don't see the inflammation anymore. So, that's one of the biggest things for us. And then also with uh, implant dentistry, we're always looking at the vitamin D deficient people. So, you and I live in the upper Midwest areas where we don't get a lot of sunlight all the time. So it's always good to put them on some supplemental vitamin D also.
Right. And I was reading through your course description, and you were talking about probiotics, which you just mentioned, and vitamin D, and laser, and ozone, and hydroacoustics, which seems to be kind of the most useful. Do you have one, or do they all kind of work in combination? Can
Yeah,
you?
they all do work in combination. So, lasers help a little bit with if they have high bacteria levels. We found out we could decrease bacteria levels by 30%. Ozone, as you know too, I don't know if you know this, but some of the hospitals have keyed into this now.
Definitely.
Yeah, and some of the hospitals have had some weird type of viruses that have gone through the hospitals, and they can't seem to, get it down. And they put in the aqueous ozone into the hospital, and within a couple of weeks, it's cleared it totally up.
Wow.
So as you know, I mean, this is a game changer.
Yeah, and I thank you for keying me into a lot of these things, right? With the probiotics and the ozone. Years ago you kind of had me start getting into it. Otherwise, I would have been, behind the, everybody else and getting into this. So it has helped a lot. We use it every day. So it has, we've seen it. I'm not doing as much as you are with some of the other stuff, but it has really improved, our protocols and so much easier using the aqueous ozone.
Yeah. And then we're going to also introduce high intensity laser therapy. So we do photobiomodulation, and photobiomodulation will stimulate healing for us. But what we've seen some really exciting things with high intensity laser therapy, which is the Nd:YAG, that we could actually stimulate cartilage reformation and bone growth.
Wow.
So in implants, if I'm going to do a block graft, a vertebral cadaver block graft, and I've actually seen bone grow over the bone screws. So this
Nice
is,
problem to have having to take that bone off, right?
yeah, it was. It's like first time I did it, it was like, where in the world is my bone screws at?
Right.
But one of the things we're doing now too is you probably have patients that are coming with TMJ issues that we could actually inject exomes with PRF in there, and we could regenerate the condyles and bone that may be degenerated quite
Mhm.
significantly. So without, it's very atraumatic. So some of the cool things.
Yeah, no, it is very neat. In your experience, how much has this helped your practice as far as patients healing with no pain, implant success rates? Have those all dramatically improved?
Yeah, all those kind of come together, and my patients now kind of know that I'm always on the cutting edge of stuff. So always trying to learn things like you are, and that's a neat thing about the annual meeting is we're always camaraderie. It's sharing different types of topics, what's working for you, what's not working for you. So yeah, that's the best part about the annual meeting is just getting together with everybody, and even with our advanced implant study group, we do a lot of communication back and forth, but it's also good to visually see everybody, and you just can't do that with the Zoom call.
Right. And I agree. And that's why I keep telling people to come to these annual meetings because just that in-person sharing of knowledge and I think AAID is awesome with that. I don't believe any other organization does it the way we do and is willing to help each other out without any, backstabbing or fear of losing out on patients and stuff. It's very nice that way.
Yeah.
Um, The I guess do you have an example maybe of maybe how it was dramatically different how you helped somebody? Is there kind of a clinical case that you were just surprised at how well this worked?
For which the hilt?
Any of them. I mean, the
Yeah.
probiotics. I know you've told me some stories with that. With
Yeah. I mean,
photobiomodulation. Any of those.
yeah. So the probiotics, basically we've seen patients that have had consistently, 5, 6 millimeter pockets, and putting them on probiotics, boom, they're down to 3 millimeter pockets. Their health feels better even. So, um, let's see, saliva testing, I think, is extremely important. That more of the things we should be doing. Hopefully, the ADA they do have codings for that, but we need to have the insurance companies start to pay for that sort of stuff. So, then when more and more people do it, that's good. Um, Examples of hilt. Well, also the examples of the degenerative joints, we've done, a few cases of that already. One patient in mind, she was like 80 years old, crunching joints. It was very painful for her.
Mhm.
So we took exomes and PRF, combined them two, injected into her joint, and then later stimulated with high intensity laser therapy. And with a week or two, she was like nothing was happening. And she's just about to the year period, so we're going to take a new CT. And one of my friends who's done this for more than I have, he's actually seeing the cartilage and bone reforming in the sites.
Oh, wow.
Yeah.
Yeah. It's so nice to be able to help these people that are kind of lost and just searching for something.
Yeah. And then you see, yeah, I mean, some of the oral surgeons used to like do surgery on these patients and, they really got debilitated. And so this is simple.
And that's what I was going to ask too. I mean, aqueous ozone and photobiomodulation, big names, sound difficult, but they're easy, right? This
Yeah.
isn't hard to do.
Right, right. I mean, my staff does the photobiomodulation. I still do my own hilt because it's pretty intense in there, but it's easy, you know. Always look
And,
for the easiest things and simple things and get it get it to help the patients.
and most of it is pretty, I would say cheap, but it's not expensive, right? I mean, the ozone units, the even an intro laser isn't going to, cost you too much.
Yeah, when you think about the aqueous ozone, how much it's saving you in chemicals,
That's
saving
true.
your chairs from breaking down and your lights from breaking down and everything else. Yeah. Or else if you get sick because the patient's had flu, didn't tell you about it, and there's aerosol spray in your mouth, all that things help.
Right. And I've been using it to scrub before my surgeries and rinse out infected sockets and even sinuses and things where there's infection. So it's nice being able to use something that's so
Easy.
natural, right?
Yeah.
And easy
Yeah.
without having to go to, Paradex and iodine and things that people gag on and dislike anyways. So,
Right. Yeah. And there's no side effects. So, yeah.
right. Right. And it's been shown to kill bacteria and viruses in less than
15
1 or 2
seconds.
seconds. Yeah,
Yeah.
yeah,
Yeah. Well, even your sons did that one study that I thought
right,
was
right,
interesting with Lysol and cabbie wipes.
right. Yeah, my son did between Cavicide, bleach, and Lysol and ozone, aqueous ozone, and he put it on agar plates, and even using the Cavicide the way you're supposed to, where you leave it on for 5 minutes without touching it, the agar plate still grew bacteria afterwards, and the only thing that did not was the aqueous ozone, and that was just using it for seconds
Yeah.
on the site. So that was very interesting and kind of nice to see. So it just supported everything you had been saying, everything the studies had shown, and it just made me more confident in using it. Yeah,
Yeah.
it was neat. Um, I mean, it sounds like an oxymoron a little bit to say that a homeopathic dentist can be an implant dentist, right? But this is pretty, it kind of works hand in hand, right?
Yeah. Yeah. So, maybe we'll have some of those outsider patients that'll be coming into us and get treatment.
Yeah.
Yeah.
No, it's really good. So what kind of dentist should be coming to your course? Is someone that's curious to learn what they could be doing differently? What can they take back with them? What would you encourage? Who would you encourage to come?
I mean, from the neophytes to more advanced clinicians in there, I think everybody's going to take something back. Uh, so yeah.
I know I did, right? Once you told me, even though, right, we're diplomates and fellows of the organization, there's a lot that we don't know.
Right.
And so just that little tidbit, and I know when I tell people they've never heard of it and what it can do, especially aqueous ozone and photobiomodulation. And Yeah, it definitely does make a big difference. And you just keep me on even more recently into the probiotics, right? I get these patients in, you don't know how to help them because they have these gums that are just constantly and chronically inflamed. And you try the Paradexes, you try better oral hygiene instruction, but nothing seems to work and you can't figure it out. And then the probiotics just kind of seem to practically work well. So
Yeah. Yeah.
yeah.
I know I've used it myself. So yeah.
So
Cool.
for a dentist that's curious to get started in this, what do you recommend? Where do they get started?
Well, if they come to the workshop, that'll be a start. And then we could introduce them to all those different things, and they could decide what they want to do for their practice. But you and I know this stuff does work. It's not
Mm.
voodoo dentistry. It's not out there in outer space stuff. But yeah, simple stuff that works great.
Well, awesome. Yeah, I look forward to hearing more about it. There's still some stuff in your lecture that I know I'm not doing yet either. So, um, yeah, I look forward to it. And again, I believe it's on Saturday, correct? At from
Yeah, Saturday in the
12.
morning. So yeah, one of the last guys. So.
Yeah, no, it'll be great. So we're looking forward to it.